I love Boise. This is the best job I've ever had, and I've had a lot of jobs at a lot of different states. I'm Robert Saeed Farivar. I'm the Medical Director for Cardiothoracic Surgery at St. Alphonsus Regional Medical Center. We have a great program. The APPs, the Advanced Practice Providers, get to do a lot. They're very independent. They get to be involved in first assisting our cases, endoscopic vein harvest. We run the full gamut of adult cardiac surgery, including coronary artery bypass grafting or CABG. We do lots of valve surgery, over 20 valve surgeries per month. We do aortic valve replacement, mitral valve repair, mitral valve replacement, myectomy, ascending aortic replacement, Bentals, valve sparing routes. The PAs also get to do a lot of advanced programs such as ECMO and Impella 5.5, both done with surgical insertions and the OR and removals at the bedside, which is very exciting. There's a lot more coming down the pike as well in terms of left ventricular assist devices. The department does about 350 pump cases per year, and we have about 50 non-pumps as the VATS maze, and we do about 200 TAVRs a year that we're involved in. So 3 surgeons, about 300 to 500 cases per year, depending on if you include thoracic or not. I always take it as a sign of quality when things are done the same way every time. And so the team really knows what to expect in an operation. Everybody is treated with respect. Everybody is at the top of their game as often as they can be. Our blood pressures in general go down when we come into the OR, not go up. And our operations are very efficient. My average clamp time is 34 minutes, which is probably 2 or 3 standard deviations quicker than average. It's an intense 34 minutes, but everybody in general does well. We have a very low rate of reoperation for bleeds. I think I went over 400 cases without a reoperation for bleed. We have a very low rate of operating in the middle of the night. One of the nice things about being in Boise is I have a very big aortic practice in which we operate on a lot of these aneurysmal aortas before they dissect. And so with doing 50 or so of these every year, these are 50 patients who would otherwise get dissections that aren't getting dissections, so that helps us reduce our middle of the night emergencies. So I think people will encounter a very friendly, very cooperative team in the OR at St. Alphonsus. Likewise in the ICU, the APPs can expect to be involved in ICU care, but in general won't be called in the middle of the night for managing the patients. That's done by the surgeons as well as intensive care physicians in the hospital. My partner, Dr. Ben Taylor, also has a very big practice for robotic surgery, and he has the largest practice in Idaho for robotic lobes. He also has the largest practice in the state of Idaho for VATS mazes, which are minimally invasive atrial fibrillation surgeries, as well as appendage ligation. Boise is a great place to live. It's a great place to raise your family. It is very popular right now because there's an influx of people from California and other states that are coming to Boise because there's really a lot of outdoors activity. We have Bogus Basin 10 minutes away to go skiing. There's a lot of hunting and fishing that can be done if you like to do that. There's Sun Valley 2-3 hours away. There's McCall 2-3 hours away. There's the Sawtooth Mountains. I came from Boston, in which everything was 30 minutes to an hour away. Literally everything in Boise is 9 minutes away.